स्वास्थ्य भित्तिभूमि रे परिवर्तन आनिब एआई रोगी जीवन को उन्नत करिबारे हेब सहायक। कृत्रिम बुद्धिमतार लक्ष्य डाक्तर स्थान नेबा नुहे बरम सेमानकु भल भाव चिंता करिबा एवं रोगी जत्न नेबा पई सहायता करिबा। नुआ दिल्लीर भारत मंडपम रे निकटरे अनुष्ठित एआई सम्मेलन रे चिकित्सा क्षेत्र में यार उपकारिता एवं भूमिका उपर आलोचना पर्यालोचना करा जायछि। आजिर दिन में स्वास्थ्य सेवार एआई वैप्लविक परिवर्तन आनिबा सह कोटी कोटी रोगी जीवन में उन्नति आनिथिबा स्वास्थ्य विशेषज्ञ माने मत रखिछन्ति। शीघ्र रोग निर्णय एआई एल्गोरिथम मेडिकल इमेजिंग जेमिति कि एक्सरे एमआईआर सीटी स्कान इत्यादि कर्कट भली गुरुतर रोग को शीघ्र चिन्हट करिपारुछि। निद्रा हृदरोग निराकरण स्लीप एफएम परी एआई मॉडल सन तथ्यावली हृत्पिंड और मस्तिष्कर कार्यकलाप विश्लेषण करी रोग निर्णय करुछि। व्यक्तिगत चिकित्सा रोगीर वंशानुक्रमिक तथ्य विश्लेषण करी सठिक औषध और चिकित्सा प्रदान करिबारे सहायक होछि। नूतन औषध गवेषणा एआई कम समय मध्य लक्ष लक्ष रासायनिक और जैविक परीक्षा करी नूतन औषध तैयारी रे सहायता करुछि।
AI can have a lot of very positive impact in healthcare, particularly since we know that we have a lot of places in India as well as in other parts of the world like Africa where we don't have specialists, you don't have radiologists, you don't have psychiatrists, you don't have pathologists. And one very simple solution of AI is, the image recognition or pattern recognition. So reading X-rays, reading pathology slides, those things can be done quite well, provided the AI algorithm is trained well on good data set. So those are kind of things which are already being widely used. We are seeing a lot of new applications as well. What I would recommend is that just like when we introduce a new drug or a vaccine, we do a clinical trial. We don't just roll it out to the public. We need to assess the efficacy and the safety of any new AI product or tool before it is scaled up. That should be in the regulatory pathway. Government actually setting the standards, the benchmarks and the rules and the governance framework. It should not be in the hand of corporations, and particularly for India, it's important that when we use AI, it's for public good. This has been also repeatedly said by the Prime Minister. So whether it's health, education or agriculture, these three sectors in particular, we need to ensure that the solutions are actually benefiting those who are currently being left behind.
In India, we have created those robust regulatory frameworks so that AI is used ethically and responsibly. We have the Indian Council of Medical Research, which has come up with guidelines on the ethical use of AI. And also because AI can never be held responsible for its decisions, but humans must be. So our national regulator, CDSCO, is now working on developing the guidelines for the use of AI and software as a medical device and also software in medical device. During this AI India Impact Summit, we will also be launching our strategy for AI in healthcare for India. This SAHI, or the strategy for AI in healthcare for India, will be like a national guidance framework for all our states, for all our regulators, for all our private programs and actors, public programs, rather than a prescribed centralized mandate. And it is proposed to be released during this AI India Summit on the 19th of February. I'm also very happy to say that India, because of its continued commitment to responsible and ethical use of AI, has also recently joined the Health AI Global Regulatory Network as a pioneer country, and it is collaborating with the UK and the Singapore and contributing to the sharing of safety protocols. And this ensures that the vast experience that India holds in digital health innovations can now contribute to establishing safer global standards for all.
पूर्व चिकित्सक माने रोगीर नाड़ी देखि रोग निर्णय करुथिले, किंतु वर्तमान प्रजुक्ति विद्या चिकित्सा जगत को परिवर्तन करने आरंभ करिछि। कृत्रिम बुद्धिमत्ता वर्तमान स्वास्थ्य सेवारे एक प्रमुख भूमिका ग्रहण करिछि। प्रजुक्ति विद्या द्वारा मात्र 30 सेकेंड रे मुह को विश्लेषण करा जाई संभाव्य अंतर्निहित रोग को मध्य सूचित करा जाई पारुछि।
The AI will not make doctors redundant. AI will make doctors safer for the patient. AI will increase the productivity of the doctors. A diabetologist who will otherwise take care of maybe 3,000, 5,000 patients with the AI assistance, he may be able to take care of 30,000 people. So AI will only make doctors more productive and healthcare safer for the patient. We need both models. People who cannot afford any money to go to the private hospital need the government hospital, and the government insurance schemes are doing a great job. But at the same time, we cannot fill the government hospital with too many patients. So there is a need for an alternative treatment for people who can pay at least some premium, like as low as 3,500 rupees per year, which may cover them up to 3 lakh rupees in a private hospital. And this is possible, and thanks to government, today we have what is called as the health savings account. Health savings account is nothing but a zero balance account. Whatever money is deposited in that account can be used only for buying the health insurance. And with 3,500 rupees, if you get a coverage up to 3 lakh rupees, most families, 70% of the families can be protected. Every country in the world, including United States, England, European countries, are struggling to offer healthcare. The crises in those countries are not much better than what we are having. So India is very, very, very privileged, mainly because in a matter of time, every Indian will have a health insurance. And that will dramatically transform the way healthcare is delivered.
भारत में स्वास्थ्य सेवा कृत्रिम बुद्धिमत्तार द्रुत व्यवहार एवं स्पष्ट दिग्दर्शन एवं नियंत्रण पाइबाकु जाउछि। केंद्र सरकार द्वारा विकसित भारतर स्वास्थ्य सेवा कृत्रिम बुद्धिमत्तार रणनीति स्वास्थ्य सेवा क्षेत्र में यार व्यवहार पाई एक मार्गदर्शक एवं नियंत्रण ढांचा भाव विवेचना करा जाउछि।